Dr. Diez, lots of headaches, muscle aches, my neck pains, shoulder pains seems to be coming from a thing called TMJ. I cannot pronounce the full word. It's just too difficult for me. But basically, it's the hinges from your two arches of teeth where they come together. The two jaw joint. Here we go. The two jaw joints, and they seem to be a rather the most complicated joint in the body. I heard. I don't. Can you explain all that? And is it true that people get lots of headaches there? And how do we fix it?
Yeah. Okay. It is the most complicated joint in the body, and you're correct. Any physician, dentist, oral surgeon that's trying to treat the joint, they all agree it's the most difficult joint to treat and correct. That being said, there are some relatively simple methods that will get probably 80-90% of the population that have TMJ problems, will get them relief, and many times totally solve the problem. It's typically what's happening is because of either premature tooth loss, a patient lost a tooth at an early age and never replaced it, or just natural crowding of teeth. A lot of us have teeth that are malpositioned, crowded, and crooked. When the teeth don't line up, all right, the jaws, when we go to bite, the jaws have to work in an unusual manner, okay? They're having to kind of work around the crooked teeth. Because of that, we're putting a lot of stress on the joint. The joint is having to work in an unusual manner. I use the example of a baseball player all the time. Throwing a baseball is not a natural motion. People think it is, but it's not. And all you have to do is pick up a sports page during baseball season and see how many pitchers out there are having serious shoulder, arm, elbow problems. Same thing with the jaw joint, with TMJ. If the teeth are crooked, and again, sometimes it happens naturally, if teeth are lost prematurely, the teeth start shifting, they get crooked, you're forcing that joint to work in an unusual manner. When you do that, you start stressing the muscles, the ligaments, and that's what leads to the pain. The pain can be debilitating. Not just pain when you chew, but like you said, the pain can radiate back towards your ear and up towards your temple, causing headaches. It can cause facial pain. It's been shown to cause neck pain and upper back pain. There's a whole host of problems that joint can cause. Now, associated with the improper functioning of the jaw, typically we can trace it back to the muscles getting tense, and therefore, a lot of people are familiar with this, when they are in their sleep, a lot of times their partner will hear, or a lot of times the patient wakes up with their teeth clenched. What they're doing is they're clenching and they're grinding their teeth in their sleep. Again, it goes back to that joint working in an unusual manner and the muscles being tense, causing the patient to clench and grind. There are some really simple devices that the patient can wear. They're comfortable to wear. They put it in before they go to bed, and it will prevent the jaws from clenching and coming together. It also prevents the teeth from smashing together, because that's another problem that's caused by clenching and grinding. TMJ problems, you damage the teeth, you break the teeth, or you get excess wear, premature wear of the teeth. Anyway, these devices, like I said, are very simple to wear. They will prevent you from damaging your teeth. But what's nice about one device that we use, and it can be looked up online, is called an NTI, is that when the patient goes to clench, because the habit's still there, patient goes to clench, all the pressure is put on the front teeth, because the device is worn on the front teeth. Well, your body knows, you're wired that way, that's the way we were made, that you are not supposed to chew hard or bite down hard with your front teeth. And you can do this experiment at home. You can take a little wooden stick, don't break any teeth when you do this, but take a little wooden stick or something soft, even a piece of cotton, anything, and bite with your front teeth and observe the amount of pressure that you exert, and then put it in your back teeth and observe the amount of pressure that you exert. You put a lot less pressure when the pressure is applied to the front teeth. So when this device is in, patient goes to clench, and again, keep in mind they're asleep. They put pressure on the front teeth. The signal is sent back to the brain, hey, this is the front teeth, don't bite hard. So this signal is constantly being sent back to the brain when the patient tries to clench to not bite hard. So not only does it prevent the jaws from smashing together and the teeth grinding, but you are actually deprogramming or reprogramming the muscles not to clench. So it can actually retrain those muscles so you are not a clencher, you're not a grinder. And a lot of times that's all it takes to eliminate the pain that's caused by the TMJ.
Wonderful. Now, I know that there are chiropractors who also work with TMJ. Tell us a little bit the difference between what a chiropractor does versus what you do, the approach. And is the outcome relatively the same? Are sometimes both of them needed? What's the deal there?
You know, there's an interesting movement going on right now where we're combining chiropractic treatment with a device such as what we're talking about. And in more severe cases, I think it's very beneficial. And the chiropractor is making sure that everything is lined up. All right? And a lot of times they're treating those muscles that are all tense. So they're helping. But the reason the muscles are tense, and a lot of times the reason we get out of a line, is because of the clenching, the grinding, the crooked teeth. It all comes into play. Again, most of the time, if you can get the patient to stop clenching, 75, 90, 95, 100% of the problem is eliminated. Sometimes these patients are very, very serious clenchers. They've been doing it for years. Assistance in relaxing the muscles, detensing the muscles, if that's a word, aligning their spine, their neck in that area is important. And like I said, there's a pretty strong movement out right now where we're combining chiropractic type maneuvers with this type of dental device or appliance that we make. So I think there is a place for it, and in more severe cases, I think it's very beneficial to combine both.
Wow, wonderful. So you recommend that the person should, kind of work in that, because a person should be getting rid of the tension he has. Of course, he will get it back if the basic thing isn't if he keeps clinching or whatever it is, which in some cases may be because his teeth are not fitting and they need to be adjusted. So all kinds of stuff. So, wonderful. But there is hope for people who have. So if a person has headaches, muscle tension, he had tried a few things, it doesn't go away. A visit to the doctor, to the dentist, it could possibly help him, and or could at least eliminate of like, well, that's not the cause, or yes, it is. Let's fix it.
That's right. And I forget what the percentage is, but it's extremely high. Patients who are having headaches, these neck pains, more times than not, is caused by dental problems. And a lot of times, like we were talking about earlier, it's teeth being crooked. So a lot of times the long-term solution is to straighten the teeth so that way they work properly. But for those patients who are, a lot of these patients are miserable, Helmut. Mm-hmm. There is a device that we were talking about, a device that can be made that will prevent this clenching, and they can get relief very, very fast. Because we know that sometimes it takes several months, sometimes more than a year, to actually straighten teeth. These people don't want to wait that long. They're very uncomfortable.
Exactly.
So.
Exactly. And if on top of it they supplement it with an immediate chiropractic care, which, because what most of us don't realize is that just like your back, lower back, upper back can get out of alignment because of your feet are crooked, so can it get out of alignment because your teeth are crooked. It's kind of like the two ends,
Perfect example.
It's like the two ends. And some people, they will need the podiatrist too, because they're burning the candle on both ends. All right.
You're right.
Thank you very much, Dr. Diez. Very informative as always.